there, everyone. Can everyone hear me okay? Just want to make sure that everyone can hear me, but we're going to go ahead and get started. This is going to be Medicare 101. So this is not advanced Medicare by any means. This is just going to be an introduction to the Medicare Parts A, B, C, and D, as well as the Medicare supplements. Right now, everybody's on mute, but feel free to type in questions in the chat box. Otherwise, at the end, we will go ahead and answer questions as well. If you have a question that you know you're going to forget if you wait till the end, don't hesitate to unmute yourself and interrupt. I don't mind at all. We only have a couple participants, so if your question is pressing, jump in and ask. Otherwise, we'll go ahead and get started here. Little disclaimer first. I am not with or endorsed by the United States government or the federal Medicare program. So all this information is information that has been approved by CMS, but I am not a CMS employee or a federal government employee. Most of you already know that. So, all right, let's get started. So when do you sign up for Medicare? There are 3 enrollment periods for signing up for Medicare A and B. There is the initial enrollment period, the general enrollment period, and then special enrollment periods. The initial enrollment period is going to be the 7-month window. It's going to start 3 months before their birth month, the month of their birth, and the 3 months after. And that's typically when they turn 65. You can have an initial enrollment period if you are under age 65 and on Medicare due to disability. It would then just be the 3 months before you're eligible for Medicare based on the 25th month of having disability, the month you get disability or get Medicare due to disability, and then 3 months after. And the general enrollment period is going to be for those people who are past age 65, stayed on group insurance or some other insurance, and now they want to sign up for Medicare after age 65. They use the general enrollment period. It's going to be January 1st through March 31st. And if you sign up for Medicare at that time, your Medicare Part A will likely be backdated up to 6 months, depending on when you turn 65. And then Medicare Part B is going to start July of that following year. So for instance, if somebody waited till this January through March coming up in 2021, but they turned 65 4 years ago, when they sign up in January, their Medicare Part A will actually go backdated to August 1st, and their Medicare Part B would start July 1st of 2021. The special enrollment period would be based on loss of coverage from an employer or some other means. People that move in and out of the country can get a special enrollment period to sign up for Medicare. Generally, special enrollment periods are going to be people that work past age 65, end their group insurance coverage. They get a special enrollment period to then sign up for Medicare A and B, or one or the other. A lot of people have Medicare Part A and group insurance and then just sign up for B. That's perfectly acceptable. When you do a special enrollment period, typically you have 60 days before a loss of coverage or the special enrollment qualifying event, and then you have another 63 days after the event to sign up for Medicare Part A and B. If it's a loss of employer coverage, you actually get an 8-month window after the loss of coverage. So that's for group insurance only. You get 8 months after your loss of coverage to sign up for Medicare Part B. If you're using the 8 months after your loss of coverage, the Medicare Part B is always going to start the first of the month following when you sign up. So how do you sign up for Medicare? People that are collecting Social Security benefits, you can collect those as early as age 62. So anyone that's collecting Social Security benefits between age 62 or starting at age 65, their enrollment in Medicare is going to be automatic. The Social Security Administration is automatically going to sign them up for both Medicare A and B, and their card will arrive in the mail about 3 or 4 months before their 65th birthday. They will have an opportunity to opt out of Medicare Part B if they're staying on their group insurance, but they are automatically enrolled if they're taking Social Security benefits. If they're not taking Social Security benefits, then they can sign up to 100 days before their birth month. Typically, I just tell people 3 months, but technically you do have 100 days, so you have a little more than 3 months. And you can enroll in a couple different ways. There's actually a way that is not on this slide. You can go in person to the Social Security office. Typically, you would call ahead and schedule an appointment, but you can just walk into the local Social Security office, take a number, and do it that way. Although I don't think you can do that right now during COVID because most of those Social Security offices are not open. But otherwise, you call Social Security, you can schedule an appointment in person in the office when they're open, or you can schedule a phone appointment. You cannot just call up to Social Security and enroll right on that initial phone call. You have to set up a phone call later to enroll. So something to be aware of if you're advising clients. Let them know to do this early, because when they call to schedule an appointment, typically the appointment is going to be 4 to 6 weeks later. You're not going to be able to schedule an appointment for the following day, the following week, anything like that. So something to be aware of. Otherwise, they can always go and sign up at Medicare.gov. I do have a flyer that's a CMS flyer. Apply for Medicare in 10 minutes or less. It makes it very, very easy for the client to go and sign themselves up for Medicare A and B. Essentially, they just, the flyer has live links to socialsecurity.gov where they go and sign up, and they click on the link, put in the required information, sign up for A, sign up for Medicare A and B, whatever they are wanting to do. They can sign up for Social Security at that time as well. For anyone that hasn't seen them, this is what the new Medicare cards look like. They are going to have this completely randomized number now. So this goes back to the end of 2019. The Medicare insurance carriers will no longer accept the old Medicare numbers. So the old Social Security number with a letter after it is no longer accepted by the carriers. You have to put in this randomized number, the new MIB, Medicare, what is it? Well, the new Medicare insurance numbers that everyone's going to be getting. So Part A and Part B are going to be listed on there. They don't always have to be the same date. You can have Part A before Part B. You can have Part B without Part A, although I've never seen that personally. So. And what is Part A? So Part A is going to be the inpatient hospital care. I always refer to it as inpatient just simply because Part A and Part B are easily distinguished, inpatient or outpatient. So if they're staying overnight and they are admitted to the hospital, it's going to be covered under Medicare Part A. The first 60 days are covered at 100% in a hospital. So there is going to be a deductible, and that is per occurrence, but there is a 60-day benefit period. So initially, when someone goes to the hospital, they're going to have to pay $1,408. Then the first 60 days after that, they will have no co-insurance. Medicare Part A is going to pay 100%. And then if they spend 3 overnights in a hospital and go to a skilled nursing facility, the first 20 days of a skilled nursing facility care is covered at 100%. After that, there is co-insurance up to 100 days in a skilled nursing facility. And at that point, they need to have long-term care insurance. Any questions at this time? Anybody have anything? Doesn't look like it. Part B of Medicare is going to be the outpatient coverage. Part A is typically premium free. Part B in 2020, the premium is $144.60. There's only estimates at this time of what Part B is going to be in 2021. But from what I was looking at earlier today, it doesn't look like it's going to go above $150. They're looking at like a 2.87% increase, and it's going to be right in the ballpark of $148 a month for the Part B premium in 2021. So negligible increase there. Pretty much everyone does have to pay for Medicare Part B. That's the standard premium. On another slide, they will have the premiums for people that are high income earners. And then obviously people on Medicaid can have their Part B premium paid for them by Medicaid. So they would have the premium. It's going to cover all the medical services outside the hospital and also including emergency room visits in the hospital because you're in and out in the same day. So doctor's visits, lab work, x-rays, ambulance, emergency room, outpatient surgery is all covered under Medicare Part B. There is a $198 deductible in 2020, and it's 80/20 coinsurance after that deductible. So Medicare pays 80%, and the insured is going to be on the hook for the other 20%. Note with this, there is no out-of-pocket maximum, no stop loss. So these people, could be paying 20% and the sky is the limit there. About the Medicare Part B premium, this is the chart for 2019, excuse me. In 2020, it did raise up just a little bit, but this is going to be fairly accurate. So people making $174,000 or less that file a joint income tax return, married husband and wife are going to pay $144.60 if it's less than $174,000 a year that they file on their income tax return. It is going to be based on your income from 2 years prior. So for 2020, the IRS looks at the insured's 2018 tax return that would have been filed at the beginning of 2019. So it's the most recent tax return that they can use, and that is what their premium is going to be based on. Anyone that had a significant drop in income can file an appeal and may be able to win that and pay less if they were in the $300,000 range and now they're making $100,000 a year. They can file an appeal with Social Security, but there's no guarantees with that. So if you're filing an individual tax return, everything is basically cut in half. It's not exact, but for the most part, it's going to be about half if you're filing an individual tax return. What you're not going to get with original Medicare Parts A and B, you're not going to get any dental, vision, hearing, no prescription drug benefit, and no help with long-term care. So the first 100 days, Medicare offers coverage in a skilled nursing facility. First 20 days are covered at 100%. After that, you have to pay like $174 per day. Long-term care, though, Medicare does not cover. They have to have a long-term care plan or some other type of plan to help with that. Prescription drugs, the only drugs that Medicare A and B would cover would be drugs that are administered either while they're an inpatient in the hospital, and it would be covered under Medicare Part A, or typically it's injectable drugs, but drugs administered by a doctor in a doctor's office setting can be covered by Medicare Part B. There's no hard and fast rule with that. You typically have to just go to medicare.gov and search to see if that drug is covered under the Medicare Part B benefit. But routine dental, vision, and hearing is not covered by Medicare. If it's a surgery on your jaw, it would be covered by Medicare if it's medically necessary. But again, routine dental, routine vision, routine hearing is not covered. When you want to delay Medicare Part B, so people that are working past age 65 or their spouse is working and the spouse is younger than 65, they want to stay on that group insurance. In most cases, I would recommend to delay enrolling in Medicare Part B, but it does depend on the size of the employer. So if they're covered by an employer group plan with 20 or less eligible employees, in that case, Medicare is primary. So they should sign up for both Medicare A and B, and their employer group plan is going to be secondary to Medicare. If it's 20 or more employees, I am almost never going to recommend enrolling in Medicare Part B. Their group plan is primary, Medicare is secondary, and so they would have to exhaust their group benefits before Medicare is going to pay on any of the claims. There's no reason for them to pay the Medicare Part B premium and then have to, they're not getting any benefits out of it, essentially. There is no penalty if they delay Part B in that case because they are on creditable coverage through an employer and there's no loss of options. So they will still have open enrollment for the Medicare supplement plans when they enroll in Part B after they lose their employer insurance. They'll still have all the same options with Medicare Advantage, cost plans, and Part B as well. So you have somebody that's turning 65 and they're making this critical decision of do they want to stay on their employer group health plan? Do they want to go on a Medicare supplement plan or do they want to go the Medicare Advantage route? One note here is that retiree coverage is not creditable coverage if you delay enrollment in Medicare Part B. So if you have somebody that turns 65 and their employer group offers retiree coverage, they retire, they stay on that coverage. If and when they do decide to end retiree coverage and go onto Medicare, they would be responsible for the Medicare Part B late enrollment penalty for every year that they went without creditable coverage. They'd also be responsible for the Part D late enrollment penalty for every month they went without creditable prescription drug coverage. So if they're going to go on to retiree coverage, you want to ask them some questions. Are there copays and deductibles on that retiree coverage? Does it include drug coverage? If they opt out, can they opt back in later? What's the cost? How much is the premium on the retiree plan? If it's $800 a month, it might be worth staying on Medicare and a Medicare supplement or Medicare Advantage plan. And does it include dental and vision coverage? So all important questions if you stay on retiree or a union plan. Those plans are not always considered. Union plans can be considered creditable coverage, but retiree plans are not. Some union plans, if it's a retiree union type plan, is also not going to be considered creditable coverage. So for those of you that work with those types of groups, I would, discuss that with anyone that's on the coverage and getting to retirement age that they may be stuck on that retirement plan for the long term, or if they switch over to Medicare, they could be paying significant penalties down the road. Medicare supplement plans. I know this is not anything new to the people that are attending today, but there's 10 Medicare supplement plans offered in most states, plans A through N. Now they did discontinue plans C and F for anyone that was eligible for Medicare before 1/1 of 2020, but those plans are still eligible for, the plans are not eligible for people that turn 65 after 1/1/2020, but plans C and F are still available to those that had Medicare before 1/1/2020. So they still offer all 10 plans. It just, some people only might have 8 plans available to them based on when they were eligible for Medicare. It's going to be the same basic benefits with any carrier, regardless of what state they're based in or anything else. The plans are going to be the exact same. They've been standardized. Really what you're looking for between carriers is their rate increase history, their customer service, and then the longevity of the company. What's their AM Best rating, S&P rating, how stable are they going to be? When is it going to be the best path to go with the Medicare supplement plan? People that want to budget their medical costs. They want to pay their premiums and know how much they're going to pay out of pocket. Typically we recommend Medicare supplement plan G to clients. Plan N is becoming very popular. But with those plans, you can budget how much the insured should pay for their medical costs every year. Say it's a $100 premium monthly, just to make it easy. 12 months, you're going to pay $1,200 in the Medicare supplement premium. You got to pay your Medicare Part B premium to be on Medicare supplement plan. That's $144 and change. And then you have the Medicare Part B deductible that you have to pay if you're on Plan G. You factor all those numbers in, that's going to be what the out-of-pocket costs are going to be for your client at the end of the year, barring any exceptions that are not covered by Medicare. You can tell them within, a set dollar amount, roughly what they'll be paying. When it is also the best path, if they're travelers and they want to see a doctor far away from home, they don't want to worry about networks. Medicare supplement plans don't have networks. You go to any doctor that accepts Medicare, and they accept any and all Medicare supplement plans. With that, you don't need a referral to see a specialist. And it can help with some of the costs that Medicare does not pay, the deductibles, the co-insurance, and co-payments. Plan G also pays that Medicare Part B excess charge. I think that's important, but some agents, most hospitals are not going to charge in excess of the Medicare approved amounts. Most doctors don't either. It's going to be your specialists and specialty clinics like the Mayo Clinic that accept Medicare patients but don't necessarily accept the Medicare approved amounts, so they balance bill, and that's why I like to go with Medicare Supplement Plan G. Plan N and all the other Medicare supplement plans are not going to cover those excess charges. So the insured can be balance billed for up to 15% of the Medicare approved amount. The other key component to a Medicare supplement plan, it is continually renewable. You can keep it as long as you pay the premiums on time. You pay your premiums, they cannot take your plan away from you for any reason. No medical reason, no other reasons, as long as you pay your premiums. Medicare Advantage plans are going to be for those people that want to pay as they go. They don't necessarily want to prepay for their medical coverage. They want to pay a lower premium and then pay for their doctoring as they go. It is referred to as Part C of Medicare. It's going to replace Medicare A and B, and more often than not, it's going to include Part B drug coverage, though in some cases you can have a Medicare Advantage plan without the Part B drug coverage included. A private insurance company is now taking over Medicare A and B for the government. They've worked it out with the government where every member they have enrolled in a plan, the government gives them a set dollar amount, and that helps them to pay all those claims. And the private insurance company is gambling that they're going to take in more money in premiums and money from the government than they're going to pay out in claims. So there's different networks, PPO, HMO. We also see the HMO, POS, the point of service plans. There's private fee for service, as well as, RPOs and stuff like that. They have regional preferred providers. So preferred provider organization is going to be your PPO. In a preferred provider organization, you can essentially go to any doctor that accepts Medicare, but your preferred providers are going to be less in cost share. The co-payments or co-insurance are going to be less with a preferred provider than with an out-of-network or non-preferred provider. HMO networks, you have a limited network of doctors and hospitals. If you go out of network on a lot of HMO plans, you're not covered by the plan, you don't have coverage under original Medicare, you're paying everything out of pocket. Some HMO plans do have some like travel benefits or out-of-network benefits, and you have a higher out-of-pocket maximum if you go out of network. But for the most part, on an HMO network, if you go out of network, the insured is paying for all the costs out of pocket. There's usually one or more plans available in a county, but that is for counties that have a relatively high population. Out in eastern Nebraska, we have a plethora of Medicare Advantage plans, but as you move west across the state, it's going to be fewer and fewer. They are going to include the out-of-pocket maximum. So when it's going to be the best path for your insureds is going to be people that want to pay a lower premium. You know, a lot of the HMO plans are zero premium plans. Please don't tell your clients that they are free. They are zero premium. Medicare does not like the term free. Even the PPO plans, you know, especially in Nebraska, much lower premiums, 19, 26, 30 something dollars a month. You can have Medicare Advantage plans that do have the higher premiums, close to $100, but typically we don't see those in Nebraska. Those are in some other states. You can also use it as a backup for VA services. So if you have any veterans that are clients of yours, they get all their coverage through the VA. They're happy with the VA. They can go out and get a zero premium Medicare Advantage plan with or without the Part D drug benefit, because most of them will get their Part D drugs at a VA facility. And those zero premium plans are just kind of a backup. If they want to go to a doctor that's not at the VA, they can use the Medicare Advantage plan and have very little cost sharing in addition to Medicare. You do have to like the network of doctors and hospitals. If you don't like the network of providers, then it's not going to do you much good to be on a Medicare Advantage plan. PPO plans are going to be more forgiving, but especially HMO plans, if you go out of network, like I said, paying a lot out of pocket. And for those people that are on a low income subsidy for Medicare or LIS, Medicare Advantage plans have some added benefits for people that qualify for LIS. They can have even lower cost sharing in some of the plans. Prescription drugs, Part B of Medicare. It says prices vary by county. In our state, that's not necessarily true, but in other states that is. So in Nebraska, the plans are going to have all the same premiums across the entire state. But I know in other states, they do have regions, counties, that they have different premiums for their Part D drug plans. They are included, prescription drug coverage is included with some of the retirement plans. So for those people that really want to stay on a retirement plan or retiree coverage, they can do so. But again, it's not considered creditable coverage. So if they stay on that retiree plan and then for some reason their group insurance goes away, they stop offering the retiree coverage, or some other means they lose that coverage, they will be looking at a late enrollment penalty for Medicare Part B and D. Vets are not required to enroll in Part B prescription drug coverage. They automatically have creditable coverage through the VA. They can choose to do so if they would like to fill in prescriptions at a retail pharmacy, or if they just want to be able to, travel and fill them across the country. They can get a Part D drug plan, but again, they're not required to do so, and they would never see a late enrollment penalty as long as they have their VA coverage. Extra help with prescriptions. You can apply for a low-income subsidy. These numbers are for Medicaid in the state of Nebraska. These are based on the 2019 amounts, so they are not the most up-to-date numbers. But generally, if somebody has less than $18,735 for a single individual or $25,365 for couples, married couple or otherwise, they're not going to qualify for Medicaid, but there are going to be other resources available to them. If they have resources, which is going to be bank accounts, 401k, any other type of retirement account, if their resources add up to more than $14,390 for a single individual or $28,720 for couples, again, they may not qualify for Medicaid. There are different levels of Medicaid that people can qualify for based on their income, based on their resources. It can help with their deductibles, their copays, and their premiums. So people that qualify fully for Medicaid typically will have no premium, very little copays, and no deductible on their Part D drug plan. People that qualify very selectively for Medicaid can have some cost sharing reduced, but it's not going to make everything zero. The 2020 donut hole, and I did add in the 2021 numbers on this slide as well. because I do have those available to me. It's about the only thing for 2021 that they have announced. So the coverage gap, the donut hole, you'll hear it referred to as a couple different things. When you get to $4,020 in 2020, so through the end of this year, if you have a client that gets to $4,020, what they spend and what the insurance company spends, if they're on a Part D drug plan, gets to $4,020, they fall into the donut hole. Between the donut hole, $4,021 and $6,350, they're not going to pay more than 25% of the cost of generic drugs or brand name drugs. They do get credit for 95% of that retail cost. So even though they're only paying 25%, they get credit for 95% to get out of the donut hole and get to the catastrophic coverage. In 2021, those amounts are going up to $4,130, and the top end of the donut hole is going to be $6,550. When you do start catastrophic coverage, it's 5% or a nominal amount for your generic or brand name drugs. It's like $3 and change for a generic and $5 and change for a brand name drug, or 5%, whichever is higher. So you're not going to get the benefit on the catastrophic coverage. It's whichever is higher. Any questions about Medicare 101? You guys can go ahead and unmute yourselves. Talk out loud, type it into the chat box. I haven't seen anything in the chat yet. I'll give it a couple minutes in case people are figuring out the computer. But while I'm waiting, if anybody, oh, it looks like Lynette has a question. Lynette, what is your question? Well, while I wait for Lynette to type out a question or unmute herself. From here on out up to the beginning of AEP, I will be doing webinars. So next Wednesday, we're going to do a webinar with Medicare over their Medicare Advantage and cost plans. And then I'll also be doing a little tutorial on CSG actuarial, which is going to be the new quoting system that will be live hopefully by tomorrow, but definitely by next week. Lynette, sounds like you're unmuted. What can I do for you?
Okay, so I sent you an email on this, but I figure you could just answer it now. So on supplements, if you've got somebody like my mother who's 86 and is losing the plan that she has a guaranteed issue for Plan G with Blue Cross, correct, but not mutual?
Correct. So the way that it's spelled out in the Guide to Health Insurance for people with Medicare, if you lose your Medicare supplement plan, you're only going to be eligible for certain guarantee issue plans based on the Medicare eligibility. And I'm going to go try and find that guarantee issue and show you quick.
You know, and on there, Plan F is her guaranteed issue, but I thought you and I had a conversation where mutual will do a Plan G.
Not mutual, Blue Cross. Yes, Blue Cross will do a Plan G, but Mutual of Omaha, you have to prove that they are eligible for that. You're not going to be able to prove that. So let me go and double check that real quick, though. We have the guarantee issue rights here. So, and hopefully you guys can see this as well. Let's bring on the second page, but If your Medigap insurance company goes bankrupt and you lose your coverage, you're going to be eligible for Medigap plans A, B, C, D, F, G, K, or L, but the asterisk is going to be note if you're eligible for Medicare before 1/1/2020, you're only eligible for C or F. And if you're eligible for Medicare after 1/1/2020, then it's D and G now. So in your mom's instance, it's only spelled out that she gets A, B, C, F, K, or L. But Blue Cross and Blue Shield said that they will honor guarantee issue for Plan G for anyone that has a loss of coverage. They usually go off of retirement. Let me look up their underwriting guide real quick for you as well. All right, so on here, guarantee issue. So they guarantee you all plans, even G and N, if you're working and you retire. Loss of coverage.
Because on her plan, it didn't go bankrupt. She just ran out of money in her personal fund.
Oh, that's right. So she didn't have a Medicare supplement plan. That was the group insurance, right?
Yeah, she had the group insurance where they put like 50,000 in there, and then when it runs out, then
yeah,
she has to find something else.
So I believe she's still going to be able to get Plan G with Blue Cross and Blue Shield.
Okay. We'll attempt it.
Yeah, I think we can apply for Medicare Supplement Plan G. And I mean, worst case scenario, we might have to settle for Plan F. Otherwise, you can always look at a Medicare Advantage plan or a Medicare cost plan for your mom.
Got it. I just wanted to confirm the G part.
Yeah, the only chance she would have for Plan G without underwriting is going to be Blue Cross. The other companies are going to hold fast and make you turn in proof of a guarantee issue period for Plan G, and you're not going to be able to prove anything that she has guarantee issue for Plan G with the other companies. So, any other questions? It looked like maybe Dennis, did you have a question? Okay, I'm having trouble reading this. Oops. So if you're covered by a spouse group plan and you turn 65 before 2020, are you still able to purchase guaranteed Plan F? If you want to, when you leave the group plan. So yes, if you were eligible for Medicare before 1/1/2020, and you lose your group insurance plan, you get that guarantee issue period for A, B, C, F, K, or L. You do not get Plan G. So it depends on when they activate Medicare Part B, I guess. If they're just activating Medicare Part B for the first time when they end their group coverage, they can choose any plan of their choice. A, B, C, D, G, F, K, L. The sky is the limit there. If they are not enrolling in Medicare Part B for the first time, if they have A and B and coming off of group coverage, then it's only A, B, C, F, K, and L. So, any other questions here? Well, thank you all for attending. If there are any other questions, feel free to email Kay Lindmeyer at ociservices.com. So I have my email address here up on this last slide. Otherwise, you can always email Medicare at ociservices.com. I know that's much easier to remember than how to spell my last name. So email one of those and we'll get you the answers to your questions. Otherwise, thank you again for attending. I know we ran a little bit long, but be prepared for more emails. I'm going to send out an email hopefully before the end of the day today, maybe tomorrow, with the webinar for next week. But again, I'm going to do webinar Wednesdays. Every Wednesday up through October 14th, we will have a webinar that I'll be hosting on different Medicare topics. Next week is Medicare cost plans, Advantage plans, and then also ESG actuarial. And then the couple weeks after that, I'll be doing e-app tutorials. So how to do an e-app with the different Medicare Advantage and Medicare, supplement companies. And we will also probably be doing some Medicare Advantage DSNP training with UHC. So be prepared for those. Thank you again for your time. Everyone have a wonderful rest of your day. And let me know if there's anything that we can do for you moving forward. Bye-bye, everyone.